Okay. Well, I just want to thank you all for for presenting and sharing with us your thoughts. Thank you. Finally, we have our retiree representatives. So again, 3 minutes each maximum. You don't have to use all your time if you don't want to. Tim Behrens, President of California State Retirees. Ken Bryant, Retired Battalion Chief of the Modesto City Fire Department. And George Lynn, President of the Retired Public Employees Association. Welcome. I think we'll begin with Mr. Behrens. Thank you.
Thank you, Dr. Pan. My name's Tim Behrens. I'm the president of the California State Retirees. We represent just over 34,000 retired state employees. I'd like to thank you for holding this hearing and for inviting retirees to be part of it. We share the views of others that high deductible plans are the wrong path to take in addressing high health care costs. They shift costs to workers, discourage people from accessing needed health care, and will divide our health plans into those for the young and those for the old. But perhaps the bigger concern for state retirees is that the high deductible plan is a backdoor way to reduce the health care reimbursements promised to us current retirees. Current retiree reimbursement levels are based on the averaging of the premiums of the 4 most utilized plans at CalPERS. If one or more high deductible plans become among the 4 most utilized plans, there is a potential that would significantly reduce reimbursement rates for state retirees. State retirees lived on a fixed income and have little or no ability to adjust to increased health care costs. As such, we view any attempt to shift to higher deductible health plans as a threat to our health care and our retirement security. We believe that high deductible plans are inappropriate for active employees and therein the health care of us retirees. We would urge the legislature and the administration to find more appropriate methods for addressing health care costs, and we would like to be part of that plan. Thank you.
Thank you. Thanks very much. Mr. Bryant.
Good morning, co-chairs and members. First of all, thank you for allowing me to speak here this morning. As stated, my name is Ken Bryant. I served 27 years as a firefighter in Modesto, earned the rank of battalion chief, and I retired in 2001. You know, when you become a firefighter, you take on a job that you know puts your life at risk. We all know that, but you know it's a job that's also going to take a toll on your physical health. Even if you're like me, fortunate enough to make it to a normal service retirement, you're going to face some heightened risks for cancer and other chronic illnesses of that type. And to put it bluntly, you're going to have some nicks and dings from doing the job for 25 or 30 years. And, you know, having been a firefighter, you're going to use and you're going to need additional health care coverage. And for a lot of retirees in public safety, a high deductible health plan is practically an invitation to financial hardship. For retirees, a health savings account isn't an option. Unlike an active worker, retirees can't count on a contribution from the employer. And since we're utilizing the health care system more already, contributions to an HSA are just that much more coming out of your pocket for health care. A lot of firefighters from my era face these challenges without the safety net of Medicare. As with Social Security, Medicare wasn't even an option for us until 1986, and anybody hired after that date was paying the Medicare portion of the Social Security premium. I had the good fortune before I became a firefighter. I came to this occupation fairly late in life compared to most. I had the good fortune to work for some employers that were participants in the Social Security system, so I'm fortunate enough to have Medicare coverage. Many from my era don't enjoy that, and so their health care costs are even higher than most. You know, a lot of us are forced to retire early because of the demands of the job, and they aren't going to get any relief when they turn 65 because they don't have Medicare coverage. You know, a lot of folks here have talked about you know, the cost-shifting aspects of high deductible health plans, and this is especially serious, as Mr. Behrens alluded to, for retirees. When I was a young firefighter, I was part of a shared risk system. Everybody pays in and the costs even out. But in that system, young firefighters, who like most young people, think they're somewhat invincible. I used to say they'll think they're 10 feet tall and bulletproof. They figure to opt out for the less expensive plans because they're not going to get sick. They're not going to need it, right? That's their mindset. The more that happens, the larger and more demanding the burden becomes on retirees. We're already seeing the impact of this burden. Hospitals are reporting an increase in bad debt as people who are opting for high deductible health plans can't pay their bills. So an idea supposedly designed to help reduce uncompensated care is starting to have the opposite effect. As a society, we're already in the midst of a crisis of retirement security. Over the last few decades, the move by private sector away from pensions to private retirement accounts has shifted retirement costs onto workers and retirees. The result has been predictable. People working longer, retiring with less, and older Californians facing a greater risk of poverty. A few of the speakers before me referred to the high incidence of poverty in the state of California. And a move to high deductible health plans, I believe, is going to produce the same kind of cost shifting onto the backs of retirees and older workers. The end result could ultimately mean more, even more desperate times for our aging population. So, in conclusion, as Mr. Barron stated, I think it's a bad idea. I know you've heard a lot of information here this morning, and I'll end my remarks with saying that you can add my name and the name of a lot of folks from my era to the folks that think this is a bad idea. Thank you.
Thank you. Mr. Lynn.
Mr. Chairman and members, my name is George Lynn, and I'm the president of the Retired Public Employees Association, RPEA. Nearly 30,000 members come from all three groups of public employees: retirees from public agencies, the state of California, and classified retirees from schools. Thank you for allowing me the opportunity to comment on the governor's proposal to establish a high deductible health care plan in CalPERS. My retiree members on a fixed income are obviously concerned as they grow older and deal with health care costs. Specifically, we are very concerned about the negative impact the change to a high deductible health plan would have on the rates of other plans, and in the end, the rates that active employees and retirees pay. The danger of making global changes is that there are individuals in different demographics who are impacted in significantly different ways. It is obvious that young and healthy employees would gravitate to a high deductible plan, since many of them don't go to the doctor. They don't go often, they don't go at all in some cases, and at that age many of them feel that they will never get sick. My personal knowledge, I have a good friend who, under the ACA, selected a very high deductible plan, and he has not gone to the doctor when he has been injured, and it has ended up costing a considerable amount at the end. And so that is just an example I have personally of how these things really don't work. We all know that the longer you seek medical attention, the more complicated and ultimately the more expensive the treatment can become. The equation worsens when thousands of young and healthy folks move into a high deductible plan because the older employees would now in those plans be escalated rates. Escalated rates would happen, leaving older employees and retirees burdened with increased health care costs that are unpredictable, onerous, and impossible for the older folks to budget. The math grows more damaging as we move forward. As the high deductible plan increases the number of enrollees, it is likely to become one of the top 4 plans. And we all know that, and the committee understands, it's the top 4 plans that are used to calculate the contribution formula for state employers. Simply put, this is what a high deductible plan is about: shifting significant costs from the employer to the employees and retirees. We're on record as fully supporting CalPERS' efforts to contain costs of health care. We have borne the brunt of copayment and deductible increases over the years. We have been part of the solution as California enters a long-sought economic recovery. We're all becoming better and smarter consumers of health care. we want to continue to be part of the communication and discussion on long-term increased high-deductible plans. We must oppose this. The impacts are far too serious to the most vulnerable retirees and will leave California seniors without realistic options. Thank you for the opportunity to speak with you.
Okay, thank you. Questions from committee members? Okay.
I just want to thank you on this panel representing retirees, and also the prior panel representing our workers, and for representing all your members, for sharing the personal experiences of your members, and just wanted to let you know how helpful and meaningful it is. Thank you.
Thank you.
And I, too, also want to thank you all. And I appreciate particularly the remarks about our public safety employees, our firefighters and peace officers, because I know that those jobs, both the physical and mental demands and the price that many of your members pay in terms of their health for doing those jobs. So I appreciate those remarks. Thank you.
Thank you.
Okay, so concluded our formal presentations. We are now ready to take public comment. I would ask that we can limit the comment to a minute, if that's all right. And so if people want to line up at the microphone there, for those who wish to make public comment. Sarah, I think you're first.
Mr. Co-Chairs, members, Sarah Phlox from the California Labor Federation. Just wanted to thank you for having this hearing. There's not much I can add to the panelists and my brothers and sisters from the public sector, but I did want to say that this is something that goes beyond just public sector employees. In the private sector, we have both employers and union trust funds that look to what's happening with large purchasers like CalPERS. They're able to kind of set the standard. And so we have looked to CalPERS for really innovative strategies on how to reduce costs while maintaining quality, things like reference pricing and other programs. And so we are very concerned that high-deductible health plans, which we oppose, would be included. A 2013 article in the New England Journal of Medicine called high-deductible health plans blunt instruments that kind of beat down prices at whatever cost. And we just expect better from CalPERS. We expect very innovative, targeted, strategic initiatives. And so we hope that they will be able to continue those and not use blunt instruments. Thank you.
Thank you. Thanks.
Hi, Chair, members. Lance Christensen. I'm the director of the Pension Reform Project at Reason Foundation, and I appreciate the conversation the legislature is having, that we're actually addressing the needs that our seniors have and retirees have within the system to make sure they get the benefits they were promised when they worked at the state. Unless there's reform, as was not addressed in PEPR a few years ago by the governor, then that's problematic in the future. The pay-as-you-go system is problematic as well. We should really be thinking about how we pre-fund these things so that we won't continue to be the second highest with unfunded liabilities in the country, as reported by the National Association of Retirement System Administrators. The discussions we're having here, while we don't have a recommendation on the high costs of these premium health care designs, this is the first step, and we appreciate the legislature's involved and hope that we can, again, make some reforms so that the benefits are there when people retire in the future. Thank you.
Thank you.
Beth Capel on behalf of Health Access California. We have a long record of opposing high-deductible health plans. You've heard a lot about them today. One thing we would suggest that's perhaps not within the purview of this committee, but certainly should be a consideration for Finance and LAO and PERS, is the impact on Medi-Cal if lower-income employees and their families are discouraged from enrolling in PERS coverage and instead opt for Medi-Cal. And so I think a thorough cost analysis would take that into consideration. Thank you.
Thank you. Seeing no one else at the microphone, Chairman Bonta, did you have any closing remarks?
Sure. I just want to thank all the panelists for your participation today, all the participants here as well, and members of the public for your participation. Thank you to all my colleagues. I thought it was a very robust and helpful and informative discussion. Thank you.
Senator Cooley, did you want?
Yeah, I'll just say thank you for the participants, also to chairs and staff for putting this together. Another outstanding hearing. Sorry I arrived late, but very well developed.
Okay. All right, and I too just want to thank all the panelists and the public comment as well. I think that was very informative, and hopefully we had a lot of very important information that was presented that will help us guide making the right kind of decisions in our state. So certainly, I think it's raised a lot of questions about the actual benefits, either financial or health-wise, of the governor's proposal for high deductible health plans, and hopefully that what came out in this hearing will be part of that. Will be part of a important discussion about what's the right thing to do for our state and for our employees. So again, with that, I'm going to declare the hearing adjourned. Thank you.